One of the commonest procedures in the world in surgery is the tonsillectomy. Tonsillectomy is to excise both tonsils under general anesthesia. It's always should be done completely without remnant and with complete hemostasis to avoid post-operative bleeding, which is very dangerous to the patient. Pain always post-operatively referred to the ear, and the patient cannot open his mouth or cannot swallow. So you should always encourage your patient to take plenty of fluid and to swallow always like chewing gums. And the idea is to decrease the pain during swallowing and to decrease the pain referred to the ear. Post-operatively, the tonsillar fossa become coated with a white exudate, which can be sometimes mistaken by a GP as a sign of infection, and this should be put in consideration. We have to have certain indications for tonsillectomy. Unless there is a certain indication, you should not remove the tonsil because it's a part of the immune system of the body. So you should always be scientific and acting according to the indications. One of the important indications are the absolute indications for surgery. These are there are subcategories of this indication. One of them is the malignancy. As you know, malignancy is one of the absolute indications to remove the tumor or to take a biopsy. Or there is an obstruction. Whenever there is an obstruction to the airway, it is a dangerous condition. It may, especially in children, the patient have snoring and attacks of apnea, which is by definition it's cessation of breathing within lasting for 10 seconds, and this apnea, if it is more than 10 times per 1 hour, it means the patient is complaining of obstruction to the airway. And what we are dealing with the obstruction is the apnea is the obstructive type of apnea rather than central type. Obstructive, it means there is something obstructing the passage of the air from the nose to the larynx, and this is important to be checked. And whenever you suspect a patient has obstructive sleep apnea, you should always relieve it by tonsillectomy. The other indications are relative indications. You might do the surgery or you might not do it, but the absolute is always you should do the surgery. In this picture you will see the tonsil after excision. There should be complete removal of the tonsil and the lingual tonsil, which the arrow indicated. If you not remove the whole tonsil and if you left remnant, it will regrowth. So tonsillectomy should be excised completely, and the presence of capsule is always facilitate its complete removal. Against the removal of the adenoid it hasn't the capsule which cannot be removed totally. So there is a risk of recurrence of adenoid after adenoidectomy. In this picture you will see how large is the tonsils. They are closing the oropharynx, the inlet of the oropharynx. Suppose this patient presented to you and he is a child also with adenoid, and so there is always obstruction of the airway from the nose and here from the oral cavity. This patient definitely has snoring, definitely has sleep apnea, which is important indication for tonsillectomy, and if there is adenoid, also for adenotonsillectomy. In this figure you will see the post-tonsillectomy. Patient did the tonsillectomy. Immediately post-tonsillectomy, second day, you will see this whitish discoloration or membrane on the tonsillar bed. This is not an infection. This should be put in your mind, because it is it's normal. It takes around 10 days until the fossa return its normal color and epithelialized. The most common complication of tonsillectomy or adenoidectomy is the bleeding, and in the bleeding we have primary one, or reactive hemorrhage, and a secondary hemorrhage. The important is the reactive hemorrhage, or the primary one, which can happen either within the first 24 hours or within the operative theater. The important is when it happens within 24 hours, because at the theater the surgeon can always deal with it. But in the ward, you are responsible for checking the patient with bleeding post-operatively. Important to check, you have the vital signs. This is important. You have to check post-operatively the vital signs of the patient. Pulse rate will be increased, blood pressure will be decreased, respiration will be increased. All these are indications of losing of blood. It means hypovolemia. Before the patient go to a state of shock, you should check him and see the blood in his mouth. Sometimes the patient is still under anesthesia, is not recovered well, so you should always put him in a supine position and try to put him on the side، يعني تخليه على الجانب، على جانبه مو على ظهره. And always reduce the head of your patient، نزل راسه للمريض and put a white sheet or gauze under his mouth. If he is conscious, he will always spitting blood from his mouth, and you can see this. If he is not, you should use your fingers to open his mouth and see inside the mouth. If there is bleeding, or if there is a swallowing of blood from the neck, if you see the neck there is frequent swallowing, it means there is something in the mouth and the patient is always swallow it. This is important to be checked, and whenever you are sure there is bleeding from the site of the tonsil, you should always inform your senior, and immediate resuscitation should be done by IV fluid, and you should also prepare blood for your patient and blood transfusion if he needs. And the important is immediate return to the theater. Immediate return to the theater to running the bleeder and stop the bleeding, and then you can save the life of your patient. The other type of bleeding is the secondary bleeding from the site of the tonsillectomy, and this it always happens after 24 hours. You know, it takes 3 days for the infection to start, because the most common cause of bleeding or secondary bleeding is the infection. And you can see a blood clot on when you open the mouth of your patient, a blood clot on the tonsillectomy bed, and this is an indication of infection. Most of the secondary bleeding is amenable to treatment by antibiotic and plenty of fluid, and most of the patients will respond to the treatment. Very rare you might have severe bleeding in the secondary type of bleeding after tonsillectomy. The adenoid is a collection of lymphoid tissue in the postnasal space. It is part of the immune system, part of the Walden's ring of lymph nodes. Sometimes due to infection, upper respiratory tract infection, or in children, it will lead to hypertrophy of this adenoid, and when it becomes hypertrophied, it will lead to pathological sequelae. One of the symptoms is the nasal airway obstruction and nasal discharge. Child presented with airway obstruction due to the nose, and he is snoring, and there is a discharge from the nose. Type of the discharge or the color may be yellow if there is infection with it, or sometimes it is scanty white, and this patient always has a mouth breathing, sustaining or mouth breathing rather than the nasal breathing. This is important to be checked. The size is important, and one of the important checking methods is by examination, by fiber optic, or by postnasal space examination, or by lateral view of the neck to show by X-ray to show the size of the adenoid and to show if there is obstruction to the airway, like in the next slide. In this patient, when there is a symptoms, the symptoms also may affect the ear, and it's important. And you know the ear function is the hearing, and if there is involvement of the hearing of the patient or impairment of hearing by frequent attacks of acute otitis media or otitis media with effusion, so you should save the ear and save the patient ear by removing the cause of obstruction, because it causes obstruction to the eustachian tube in the nasopharynx, so it prevents the drainage and it is a source of infection to the ear. So adenoidectomy in this stage is important. Special attention to child with acute tonsillitis when you admit such a patient. You can admit him when he cannot take his oral medication and fluid, to give them by IV route. By the way, the fluid is important for a patient with an acute tonsillitis or pharyngitis, because it is not just an antibiotic. You should always prescribe plenty of fluid if he can take them orally to make his fluid electrolyte balance in the body is stable. In case of an infection, the patient always has dysphagia or adenophagia, and his fluid intake will be decreased, so you should always replace. In case of infection, tonsillitis or pharyngitis, in case of infection, there is high fever, and in high fever the patient lost his fluid from the body, so also it is important to replace. In case of infection, the patient might have another symptoms like vomiting and diarrhea, especially in children, and these are causes for loss of fluid from the body, so you should replace them to maintain the electrolyte and fluid balance inside the body. Another indication for admission of a child is whenever there is significant sleep apnea, which should be monitored and should be given IV steroids to decrease the edema associated with the condition.